Hi, my name is Pam Rogers. I am a mother of 4 and my eldest son, Christopher, who's now 10, was born with CMV. I'm joined today by Lisa. Lisa, can you please quickly introduce yourself?
Hi, Pam. So nice to talk to you today. I'm a doctor. I specialise in maternal fetal medicine and I work at the Mercy Hospital for Women and the Northern Hospital in Melbourne. And I'm also a researcher. So I'm a professor at the University of Melbourne and I lead the reproductive epidemiology group at the Murdoch Children's Research Institute.
That is a lot. Thank you so much for joining us today. Just very quickly before we jump into all the nitty gritty, I've just got a couple of icebreakers just so we can get to know you. First off, what is your idea of a perfect Sunday afternoon?
Okay, my idea of a perfect Sunday afternoon is actually at home with my family, with my husband and my 2 kids and my dog. Probably cooking a very big lunch and eating together and perhaps pottering around in the garden and going for a walk down into our local parklands afterwards.
That sounds so nice. I love Sundays. They're my fave. Are you a morning person or a night owl?
Definitely a night owl.
Yeah, me too. And what's your favourite food or snack?
My favourite snack's probably dumplings. So that's yeah.
My
Bit of
girls
a downfall, I think, for me.
No way. My girls
Yeah.
adore dumplings. It's their favourite. Every opportunity that they get, they want dumplings. Okay, so a little bit more serious. Can you please give us a quick overview of your career and how you ended up studying CMV?
Okay, quick overview of my career. I actually started off life wanting to be a journalist. So this is predating medicine. So I did that for 2 years and then I decided I probably didn't have the personality for a cut and thrust career in journalism and I changed to medicine and have not regretted the decision once and very quickly decided I wanted to work in women's health and in obstetrics and gynecology. So that's what I did my specialty training in. And then I did some further subspecialist training in maternal fetal medicine. So that's where you study prenatal diagnosis and looking after women with particular health conditions in pregnancy and ultrasound and other diagnostic techniques for fetal conditions. So that's sort of how I came across women with CMV infection in pregnancy and started to learn about what a complex area it is and about all the potential health effects that an infection in pregnancy can have for the child.
Yeah, lovely. Okay, so we're going to delve a bit more specifically into the research that you've been doing. So we're just going to have chats today about the screening for CMV in pregnancy. So what are the current Australian guidelines for screening in pregnancy?
Yeah, so when we talk about screening in pregnancy, I guess what most people mean when they talk about screening is actually doing a blood test for every woman at the beginning of pregnancy with all the other routine blood tests to look to for any evidence of previous infection with CMV. It's a very common virus and most of us have had it by the time we're adults and planning families. But in Australia, maybe about 40% of women, start off their pregnancy with no sign that they've ever been exposed to this virus before. So at the moment, our national guidelines don't recommend that every woman have a test in early pregnancy to see if they've had CMV before. The way it might be used is if there's a suspicion later on in pregnancy that a woman might have acquired the CMV infection. Having that early blood test is very helpful for working out whether it's a first infection ever during the pregnancy or whether it's potentially a repeat infection or a reactivation, which is something that we know that this virus can do. So at the moment, our Royal Australian and New Zealand College of Obstetricians and Gynecologists don't recommend that every woman have that blood test, but they do suggest that if a woman has a lot of contact with toddlers, because they are a common source of CMV exposure, that their doctor or midwife might consider doing that blood test so that the woman knows if she's had prior infection or not. And that can be very helpful for interpreting the results of later blood tests or ultrasounds. So that's kind of where our current guidelines are in terms of screening. So they're recommending considering targeted screening, it's called, for the women with a higher chance of coming across CMV, rather than universal screening, which is testing everybody.
So do you think that that's the direction it's potentially going to go? It'll be targeted rather than like blanket screening?
Well, our guidelines are due for an update this year, and I think the recommendations may change a little bit, perhaps in their emphasis. I don't want to preempt what's going to happen because we haven't done that evidence review yet, but I guess what is very interesting is that the European community have come out recently with a consensus guideline that recommends that all women in Europe be screened in pregnancy for evidence of CMV, prior CMV infection. And then if they've never had CMV before, the Europeans are recommending that women have a blood test again in pregnancy to see if they've showing any evidence of having caught the infection during the first trimester. And the reason why they're recommending that is because most women don't have any symptoms when they catch it. So unless you do the blood test, you may never know if you've been if you've caught this virus. And now there's a potential treatment that can be given to women who've caught the virus for the first time while pregnant, and this treatment can reduce the chance of the infection passing to their unborn baby.
Beautiful. So what was your study trying to find out?
So we were kind of anticipating that practice was going to change, and we thought that we needed to do some groundwork and be ready for the potential for CMV screening to become more widespread. So the first thing that we thought we needed to do was increase the knowledge and awareness of GPs and other people who look after women in pregnancy, because we've known from prior surveys that the awareness amongst healthcare professionals is actually very low. So we've developed an online learning module for GPs. It's free, and we did that in partnership with the Cerebral Palsy Alliance, and that's being rolled out, and we're currently evaluating that. And we've been very happy to see that the GPs who've participated in the evaluation have shown that they found it very helpful and that it's improved their knowledge and actually changed the way they intend to practice. So that's the first step. We wanted to make sure that the people who see women in early pregnancy are actually well informed about CMV. We also wanted to make sure we had resources for women so that they understood what CMV was. Most babies that are born with CMV are completely healthy, and it's only a small proportion that will have significant health impacts. So striking that balance between raising awareness and then not causing too much anxiety and fear is a really hard line to walk. So we're evaluating a 2-minute education video for women, really giving them the knowledge to help reduce their chance of acquiring this infection. So that's the other research we're doing, just checking that education video does what we hope it will do, which is sort of increase knowledge but not increase anxiety and fear too much. And then the third thing we're doing is actually seeing if it's feasible for our hospital to support a program of universal screening in pregnancy. So most women, when they discover they're pregnant, they go and see their GP, and they have that diagnosis confirmed with a blood test, and then they usually have all those early pregnancy discussions and any screening tests that are recommended or desired. So we've been offering women who've been referred to the Mercy Hospital for Women the opportunity to have further CMV screening if their GP has already done that screening for them and they're found to be CMV negative. So it's kind of, I guess, a little bit of a test run to see whether our hospital and our health systems have the capability to do what we hope to do, which is actually do follow-up testing at around 12 weeks of pregnancy and get the results to women in a timely way, and to see how women feel about having that testing. So we're asking them about whether it's increased their levels of anxiety, whether they were happy that they were involved in the screening, and if they are happy that, these sorts of tests were ordered and the results returned via telephone and email. So that's our pilot study that's running at the moment. We're recruiting now.
Yeah, lovely. It's so encouraging that the GPs are responding well. It's so important that they're getting the information to women so early. Thank you for that. It's been a little bugbear of mine for quite some time.
Yes.
And I love that there's these big movements now to educate women and to make sure that GPs and midwives are on the train of helping support them through that space.
Yes.
So what did you do during your study to try and to gather this information and answer the ultimate question around how women were feeling about the universal testing as such?
Yeah. So we've done a qualitative study where we've interviewed women who've previously been diagnosed with a CMV infection or suspected CMV infection on the basis of blood tests during pregnancy. So we interviewed 12 women, and we've published that research earlier this year. And that's where I think a lot of our research has been really guided by what those women were telling us. And that's where we discovered that it's not just about offering a blood test in pregnancy. Yeah. It's actually giving women won't thank us if we tell them that the blood test shows that they've been infected with CMV in pregnancy, if no one's told them how they could have prevented it. So that was a really clear message. So the screening message also has to go out with the hygiene messages about washing your hands after having contact with a toddler's snot or saliva, and washing your hands after changing nappies or wiping your toddler's nose, and not sharing food with them so that you're not getting their saliva in your mouth. So we realised that we had to do that background work first, so that women have both the message about how to protect themselves and also the message about how we can pick up an infection in pregnancy. We also heard very loud and clear from women that being told that they might have caught this virus and it might affect their baby's development. It's a really stressful experience, of course. And what helped women get support through the pregnancy is if they had a supportive and knowledgeable healthcare provider. So that, again, speaks to the importance of education of healthcare professionals, and also supportive partner and family, and also having access to online information. So we've been working on all of those components, making sure that there's good information that's publicly available for women in this space, and that's been hosted on the Cerebral Palsy Alliance's website. So we've got patient information leaflets there. And as I said, we're doing the education piece with GPs, and there's previously been an education module for midwives, and we're doing a version for specialist obstetricians now. And then part of the resources that we've put online are also links to psychological supports and to peer support through CMV Australia. So all of that, what we learned from talking to these women and hearing their stories was really important for kind of making sure we were sort of doing whatever we are responsibly, and not creating a whole lot of, unintended harm in the process of looking for CMV in pregnancy.
Yeah, I love the thought that's gone in behind it all, and the multifaceted approach to ensuring that women are supported as best they can from an education view, but also from a psychological view as well. Again, thank you. It's so amazing that we've got these incredible people working on all of this in this space. So what do you think the implications of your findings for researchers, families, and clinicians are in the future? Very loaded question. Please take your time.
Yeah. Look, I think where we're at is we kind of have an idea about perhaps where medical practice needs to change and how it should evolve. But what we want to do is sort of bring the whole community together. And that's, I think, been a real, that's held us back a lot in Australia. So there are lots of different groups working on different aspects of congenital CMV. So there are the paediatricians, but there's also the hearing screening community. There's the maternal fetal medicine community where I belong, and then there's the laboratory researchers and the clinical virologists who are also working in this space. So our next project is to bring everyone together in a research priority setting project where we're going to ask everybody what they think the most important research questions are, and come up with a list of the top 10 research priorities, and that will give us a really good strategy to move forward as a nation, because as you mentioned, it has to be tackled in a multifaceted way. It's not a simple condition to address, because yeah. So that's, I think, where we're going to go in future, and I think that's that's going to be our next project.
And what about the families? Like, how does this impact future families who are faced with potentially being told that they've got CMV and have passed it to their baby?
So what we hope in the future for families is that they get access to good information before pregnancy or in early pregnancy about how to protect themselves. Most people have a lot of awareness about other behaviours that we encourage to optimise health during pregnancy. So most people know that they should stop drinking once they start trying to conceive, or they should stop smoking, and they should have kind of a healthy amount of exercise and eat a balanced diet. But no one really hears about the hygiene messages for CMV. They watch what they eat because they're worried about listeria. They get very paranoid about contact with cats because they've heard about toxoplasmosis, but actually CMV is much more common than either of those conditions. So we want CMV to be up there with all the other public health messaging.
Yeah,
so that it's
name again.
Yeah. And that will help support people who do, might be unlucky enough to be in the situation where they have a confirmed infection. If that happens, then at least their family and the community around them have heard of it, and they don't feel like they're so alone, and they can get some more support.
Yeah. Thank you so much for your time today, Lisa. I've loved chatting with you. It's something that's very close to my heart. And as I mentioned before, I'm so grateful that you and all of your team are working on this in this space with such consideration and passion. So thank you so much. And thank you again for your time today.
Yep. Thanks, Pam. It was great to chat.